Thanks for that introduction, James. Thank you, everybody. It's a pleasure to be here. It's kind of funny. This is my first time presenting. Obviously, I'd been aware of your guys' organization for a while here, but this is my first time presenting. And they asked me, and I was working on my slides. And at one point, I paused and I was concerned. I don't know what the average attendee, what their views are going to be like. I was concerned about maybe being a bit too radical. But after hearing Dr. Smith talk about arms dealers, I think we're all right. So I'm going to apologize a bit that this is, I wasn't sure if the introduction, so James actually hit all the main points I want to do, but there's going to be a little bit of redundancy here, but I just want to explain to you, why am I the one here giving this sort of opening formal talk. And so just a little bit about my background. As he said, I am with the Free Market Institute at Texas Tech. By the way, if you're not aware of this group, just a really quick plug for them. It's headed up by Ben Powell. He's an Austrian economist. Been to the Mises Institute several times, and so this is a very, they bring a lot of speakers. I believe they've had Dr. Paul there, they have Walter Williams, Judge Napolitano. So if that's something that is on your radar and you want to get on their mailing list, they bring in a lot of speakers. I would encourage you to do that. Also, I'm a senior fellow with the Mises Institute. Many of you are aware of that down in Auburn, Alabama. And as James mentioned, I am the co-author with ER Dr. Doug McGuff, who I believe has been affiliated with you guys, and called The Primal Prescription. And so this is a book where it was really just very fortuitous that the stars were aligned and we were approached by Mark Sisson. Doug had already written up a manuscript, and then I was also working independently on that, and Mark put us together. And so this book, it's sort of like the theory and history and practice of a lot of these ideas. And so let me just mention, before I forget, to say that I truly think this is the area in terms of privatizing medicine, delivering it through the free market, that's something where people who are interested in the ideas of liberty can really make a significant change and impact for the better in the near term, right? So things like, yes, the Federal Reserve, if you're an Austrian believer, causes the boom-bust cycle, and that would be very great if we could reform it. But obviously there's going to be a lot of entrenched interests there, and you start talking to normal people about the business cycle in the Federal Reserve, and they start glazing over because it just seems so difficult to comprehend. Whereas when it comes to, hey, did you go to the hospital recently? Did you see the bill you got? Everybody gets that. They understand it, and it's sort of practical wisdom that they can understand. So I think this is one area where significant gains are possible, and so that's why I'm so glad this organization exists. I'd also encourage you, for those of you especially who are actual medical professionals, to speak up more, because whether you think you deserve it or not, you have a certain credibility just because of that. And it's sort of like, suppose you're against U.S. foreign policy interventionism, and you see a panel on MSNBC or CNN, and if somebody's there who is like a retired general who served in Vietnam and is saying, I disagree with what we're doing, you know how that just carries a lot more credibility, whether you think it should or not. But that's the kind of thing I mean, that it's one thing for an academic economist to be sitting here talking about, oh, we should privatize such a, but if you can say, no, I've worked in the normal system, these are some crazy anecdotes, now we've done it this way, switch to cash only, and look at the results. I can't stress enough how much credibility that carries. So I would encourage you, even if it's something as simple as like writing a letter to the editor of your local paper when you see some news story that just parrots the conventional wisdom. The last thing I will mention is, as James alluded to, so I had a bit of a reputation of singing karaoke when I would go down to the Mises Institute. There was this band, Fly By Radio. This is not Photoshopped, folks. This is really me. I was not giving a lecture on Federal Reserve policy here. These are undergrads at Auburn. These were normal kids. They weren't libertarians. They were regular people. And the band called me up. We were doing Twist and Shout. Okay, so this wasn't karaoke. This was actually real music. And so this was the interlude part where dun 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 dun, and so I had to put on a show, because what else am I going to do? So I'm dancing, and but the point is, if you guys start nodding off, I'm going to start singing, just to warn you. So pay attention. Okay, so I think one of the things I can do here is I wanted to first just explain to you. So again, you saw the schedule, the brochure. I'm talking to you about the theory and history of government intervention in the free market and healthcare, and why the free market works here as in other arenas. And so if you ask a regular mainstream economist, who, they're not socialists, they're for markets, they understand the Soviet Union didn't work, they understand that markets generally do a good job of delivering goods and services at reasonable prices as long as there's competition, so on and so forth. And so if you say, okay, well, why don't we use that model then when it comes to healthcare? What's so different about healthcare? You know, we have the market delivering TVs and pizza. Why not delivering healthcare? And so nowadays, their standard response is they'll allude to this famous paper that Nobel laureate Kenneth Arrow had published. So it was back in '63 in the American Economic Review. That's one of the top-ranked journals. And so he gave the theoretical argument that's now, like I say, the standard go-to response. So like when Paul Krugman in the New York Times wants to explain, here's why these libertarians and right-wingers are wrong when they say, oh, free market, this is the kind of argument intellectually that they'll rely on. And so he lists a couple things. So he says, for one thing, there's major unpredictable expenses when it comes to healthcare. And so that's one reason that markets don't work very well in this arena. And another major thing he mentions is asymmetry of information. So obviously I'm boiling this down just for the purposes of this talk, but these are the main points that he hits in this more academic-y paper. And so those are the two things that he brings up. And so even on its own terms, you just notice that at best all that argument has really done is shown why there are roadblocks or challenges for the market to deliver healthcare, you know, why it would be more challenging than delivering pizzas or TVs. But nonetheless, it's not that he's shown the superiority of government intervention in this arena, right? So it's not enough just to say, oh, the market doesn't work as well here as it might work for something like, again, you know, buying sweaters. Okay, that's fine. I agree that the market for healthcare is different from the market for sweaters, but nonetheless, that doesn't prove, and this is why the market is trumped by government intervention. So just really quickly, of course, for the major unpredictable expenses, it's not that that's only true in healthcare. That's true elsewhere also. If you get into a car crash, that's a major unpredictable expense, and yet we don't have complete government takeover of the car market, right? It's not that people right now are calling for single payer for automobiles, although, you know, give it 3 weeks, Joe Biden probably will call for that just to compete, but, you know, just to change the narrative, get everyone to stop talking about the other stuff. So, you know, again, that's what insurance is for. It's not like this is, you know, so, oh, geez, the market would have worked but for unpredictable major expenses. No, that's what the purpose of insurance is. And as far as the asymmetry of information, this one's even more ridiculous in terms of, oh, that's the reason we can't trust the market. And if what you mean is, and therefore why we need government intervention, because, you know, it's not that, but the fact that we work through the state therefore magically solves the asymmetry of information problem. By the way, I'm sure most of you get this, but what he means by that is, you know, if you go and buy a sweater or you buy a pizza, you can tell right away whether you like it or not. And, you know, the average consumer can evaluate that on his or her own. They don't need some expert third party to tell them whether it's a good product or not. And also, too, there's another, I don't have it here in the slides, but there's another complication where with certain medical procedures or products, if you get it wrong, you know, it could be deadly. Whereas you buy a sweater, you get home, you're like, you know what, this doesn't actually fit the way I thought it would. You never wear it again. Worst thing is that you're out the money you spend on the sweater and you never buy from that manufacturer. You don't go to that store again. Whereas, you know, you go get surgery and then realize later, yeah, that doctor didn't know what he was doing. You know, that's a much bigger deal. So obviously there are some differences, but again, those things are true about healthcare, whether it's provided by the government or the free market. And the question is just, how does the political process ameliorate this problem? If you think it through, that's a terrible way to deal with it, right? So in other words, we're saying the average consumer is unqualified to say who's a good brain surgeon or not. You know, and we could stipulate that, yeah, that's true. There's a sense in which regular people can evaluate the quality of medical professionals the way regular people can decide, do I like the way that sweater looks? Do I think it's worth the purchase price? And so, okay, so you need to defer to experts in some way. And so it's kind of crazy that they're saying, oh, so the way we're going to do it is periodically have elections when people vote, you know, have a popularity contest for candidates, all of whom also are completely ignorant of these things. And then we're going to trust, though, the person who wins that popularity contest will then, amidst the 60,000 other things they're dealing with, will appoint the right experts to then tell us which doctors are qualified or not. Right, so that's a very tenuous, dubious process itself, and so clearly, you know, I would argue, and I'm sure everyone in this room agrees, that there are market alternatives to solving this problem. So again, I'm explaining to you the average economist does have a ready answer if you say, why not trust the market in healthcare? But the actual arguments, when you look at them, I think collapse pretty quickly. Okay, another thing, and by the way, with a lot of this, I wasn't sure of the background of some people. So here, some of these points are going to be fairly obvious, but I think a lot of the content here is going to be something you haven't heard before. So another frustrating thing that I'm sure you've encountered when you're arguing with people, particularly people who are touting other countries and their models of healthcare. And I do a lot of work, for example, with different free market groups based in Canada. And there, if you have to be very delicate when you write for them, because they just know what their audience is expecting. And so up there, it's a pretty standard narrative to say, oh, the United States has laissez-faire in healthcare, which I'm sure many of you would be shocked to learn. And that's, that's in their mind. So everything that they think is wrong with the outcomes in the U.S. medical profession or industry, they blame on capitalism, because they think that we have the wild, wild west when it comes to healthcare. And obviously that's not true. Okay, and to me, the biggest, the single biggest indicator, and this is what I mean when you can talk to a normal person about this. It doesn't have to be a policy wonk. Regular people in their everyday lives know this to be true, and so this is one way that I try to get the average person, because it sounds like you're just making excuses, right? If you're a defender of the free market and somebody complains about healthcare, and I'm voting for Bernie because I just got my bill the other day from the hospital, and this is ludicrous, so I'm voting for Bernie. And you say, oh, we don't have a free market in healthcare. If somebody who's already inclined to disagree with you and did not trust you thinks you're making excuses, like the communist who says, well, they didn't really try true communism in the Soviet Union. We get the right people in there, right? And so I'm saying, I like, though, this, in terms of medicine, you can diffuse that because the average person, knows some of these things. So, for example, with the cost of a pregnancy, this is one of the anecdotes we include in our book, The Primal Prescription, that there was, I forget what city it was in, but there was some anchor for a radio station, and she was pregnant, and she just was calling around to all the local hospitals to say, if I have a regular, birth with, no complications, how much is that going to cost? Just ballpark. And she called like 8 hospitals. The numbers might not be right, but this is the spirit of it. She called like 8 hospitals. 7 of them refused to give her any number whatsoever. Just said, no, we're not telling you a number. Just, come in and you'll find out how much it costs. And the last one gave her a number, but was bending over backwards to say, this is not a quote. If you come in and have it with us and we give you a bigger bill, you can't sue us. This is just a general outline. Okay. Another example that literally happened to me just a few weeks ago is I had to get a simple blood test done, and I wasn't sure if the insurance was going to cover, because it was more of a thing that I was just curious about. And so I called and this was at Texas Tech, a very nice system of healthcare for the faculty there. And I was calling around. Everybody I dealt with was very pleasant and helpful. Nobody could tell me how much this blood test was going to cost. I finally, on the third, person that I got relayed to, oh yeah, we don't know that. Let me refer you to so-and-so. So I finally got somebody who clearly was the person who would know it if anybody did. And she said something, again, very pleasant, and she was trying to be helpful. She said something like, yeah, I can't tell you how much that would be, but, I've seen lots of people coming through, and so I don't think it would be that much. And so I said, okay, all right, and because, again, I wasn't sure of the insurance, and so I said, okay, fine, so, yeah, worst case, if they don't cover it, I'll just pay it out of pocket, whatever. And then as I'm getting ready, she goes, yeah, I mean, if it were more than 500, I would be shocked. And I was like, well, that's, maybe she has a higher standard of living. That's bigger than I thought. But in any event, I went there and it was fine. I paid, it was it really was $200 and I paid $30 or something like that. But the point, again, is that's obviously not a free market. And I know you guys know this, and if we had more time, if I didn't prepare, I could just sit here and say, I want us for the next 40 minutes to really imagine this, in detail. Imagine when you went to buy a car, if you called all, you knew you wanted, oh yeah, I want a Nissan Sentra 2019 model, and you called all the local car dealerships and said, how much will this cost? And they told you, come buy the car, and then we will tell you afterward how much you owe us. I mean, if you really thought that, for one, you would say that that's impossible. That couldn't work. There would be no, but you realize, well, no, if for some reason that was the rule and that was how it had to happen, car travel is so much better than not having cars, there would still be a market for cars, but just imagine how screwed up it would be. I mean, the prices would be ludicrous. You can imagine how much cars would cost hundreds of thousands of dollars, just regular cars. Nobody could afford a car on his or her. You'd have to have third-party systems to pay for cars every time you needed a new car. And imagine then, that system had been in place for decades, and then somebody said, this is crazy. We need the government to take over because the free market in cars is obviously not working. I mean, you could see how far removed that would be from a normal market, and it'd be ludicrous. And so I'm saying that's what's happened in healthcare. And so I'm trying to make it real. I know even the people in this room are the ones most on planet Earth who understand this point, and you think it's tangible and real too. But I think just sometimes just to remind ourselves of how much better this could be. There's nothing intrinsic to healthcare that makes these costs so explosive. It's just the crazy system we have in place right now. Okay, again, I'm sure many of you have heard this, but in case some of you haven't heard particularly these points, again, health insurance, if you think about it, forget socialized medicine, just think about insurance for a minute and how health insurance is not like any other type of insurance. Okay, so for example, we all have auto insurance. You have a car, you have to have insurance on it. What is that for? It's for the rare situation where you get into an accident and have a really catastrophic, unpredictable cost that nonetheless anybody driving it might happen to, but for most people it probably won't. That's what you have auto insurance for. It's not that when you go to get your oil changed, you see the bill is really $100, but you only paid $18 out of pocket. And if oil changes were covered by your normal car insurance, think about how much that would screw it up. Think about how much your premiums would go up, how much more oil changes all of a sudden would cost, right? You see how that works. And then also they would put caps in place on the collision damage because they'd have to somehow, stem the bleeding. And so notice that, that would start looking more like health insurance. The middle point here, you ever talking to someone, hey, we're going to go to this restaurant next Thursday, can you make it? They say, oh, geez, I'd love to, but right now I'm in between jobs, so no, I can't. And what they meant was because I can't drive out there. Or if they say, you can give me a ride because right now I don't have car insurance because I'm in between jobs. And so as everybody knows, you need a job to have car insurance. That would just be foreign to us, but yet it is, matter of fact, the way life is in America, or at least was until the ACA, where plenty of people would, they have a procedure they wanted to get done, and they would say, well, I got to wait till I get my new job, because right now I'm in between jobs, I don't have health insurance, right? So that's normal, but yet fire insurance, auto insurance, life insurance, none of this other type of insurance is tied to your employer. There's some reason health insurance is. And in a minute, I'll give some of the history, so we'll see where that came from. But again, just saying right now in terms of diagnosing what the heck is going on, why is something screwy with healthcare, I'm saying clearly it's not because, that's capitalism for you, that these markets do not behave in both healthcare specifically and health insurance more generally, are obviously not like other things, even in regulated America right now. So I'm not merely saying, I'm imagining a libertarian utopia where we have a free society finally and Dr. Paul is the president. I mean, that would be great. But I'm not even comparing it to this unrealistic thing that right now eludes our grasp. I'm saying right now in the real world, health insurance does not operate like any other type of insurance you have. And it's not surprising that the average American is really fed up with health insurance companies, whereas most people don't really get mad about auto insurance all that often. There's particular horror stories, but they're not as aggravated as they are about health insurance. And for this last point too, this is something maybe you haven't really thought through, but if you ever do get, your car gets damaged, and then what you can do is you can bring it in, the mechanic or the auto repair shop looks at it, they come up with an estimate of damages, maybe somebody from the insurance company comes out, takes pictures, and assesses it. And strictly speaking, the insurance company, makes you whole. They send you a compensating check because the purpose of insurance is to say if you suffer a loss, we compensate you for it, monetarily to the best of our ability. And so you technically, especially, if your car's still drivable and it would still pass inspection in terms of, standard safety for the road, you don't have to get that fixed. You can just get the check and deposit it and use it for something else. Okay, whereas that isn't typically how health insurance works. Usually with health insurance, you have something wrong with you and you go, and then the operation or the practitioner says this is how much it costs to address this issue, and the health insurance company directly pays the practitioner the client is like this nuisance in between that's the reason for all the transfer of money, but that it's not that the client is the center of the operation, meaning like the financial operation, right? And again, it's not that you can go and say, oh, I have this thing that's wrong with me, and that's the equivalent of a $25,000 loss to my well-being, and so the health insurance company can just send you a check, and you can not have the procedure. You can just say, you know what, I can use this money for something else and deal with this illness. That's not an option. I mean, people would look at that like it was embezzlement or something with healthcare, but yet, again, notice with your car, that's standard. When you think through the logic of what insurance is supposed to be doing, that's perfectly straightforward. That, yeah, you got paid from the insurance company because something was wrong with your car, and you can choose what to do with that money. If you decide you need it for something else that's more urgent to you than fixing your car, you can do that, right? Because that's what insurance is supposed to do, yet that's not at all how health insurance works. Okay, so let me spend now, I will move through this material quickly here, but let me give you some background about the history. So, early there, I just spent some time reminding us and reinforcing how the current system is clearly not a free market and some of the particular things that are wrong with it. But let me now explain, so how did we get there? Okay, so one major thing was back in 1910, there was what was called the Flexner Report, and wanted to raise medical school standards. And so because of that, and this was right in the period when various states started implementing mandatory licensing requirements and standards. So in other words, before then, there had been organizations putting out guidelines, but they were more voluntary. Saying, in our opinion, a qualified medical professional will be XYZ, or these particular schools are good places to go. But it wasn't that it was illegal to practice medicine without having a formal license, whereas that started changing in the late 1800s, early 1900s. And so from this period of 1900 to 1930, 30 medical schools ultimately closed just because they were ruled that their curriculum wasn't up to par. And so the theory would say, oh, that's probably going to restrict the supply, right? And yes, it did by various measures. That the number of physicians per population went down quite significantly, which is just what you would expect. And so let me just take a moment here, in case you've never heard this, that Milton Friedman, in his more popular books, gives an analogy to try to explain the economic impact, even in the best case. In a few minutes, I'll tell you why I think Friedman's actually being too optimistic here. But even on face value, let's assume the government is competent in when they insist on minimum standards of quality when it comes to something like healthcare, why that's not obviously a good thing, right? Because most people, the average person, if you said, hey, should the government set standards in place for like what medical schools get accredited, and should the states issue licenses so nobody can be considered a medical doctor performing certainly at hospitals with the general public unless the state has signed off on that person in some capacity. So most average people would agree with that. They say, yeah, that's a very common sense thing to do. Maybe on the margins they might get it wrong here or there, but clearly there's got to be some basic standards. And so Milton Friedman has a good analogy to just try to get people to see why that's not obviously a good thing, again, even if you agree that what they're doing is raising the minimum standards. And so he says, okay, imagine the government passes a law that says every new car that's sold in America starting next year has to be at least as good as a Cadillac. Okay, and you could define more objectively, specifically, but suppose that's the rule and they enforce it in a certain way, and suppose they enforce it like it's true. There's no corruption involved. That every car now sold going forward really is as good as a Cadillac. Is that necessarily a good thing? Is that helping the average American? And you realize there's trade-offs that, okay, so it's certainly true in the thought experiment we're going through that everybody who ends up driving a car going forward is going to really enjoy it. They're going to say, yeah, this is a great vehicle, this is high quality, I'm very happy with my car. If they did surveys of people who are car buyers, do you like your vehicle? They'd probably, oh yeah, it's very, very high quality. Okay, but there's a bunch of other people now who can't drive at all because the government just passing that law isn't going to make the Cadillacs affordable. It's now going to be very difficult to get a new car, whereas there were a lot of people who would have chosen not to buy a Cadillac. And the obvious thing here is, as Friedman points out, anybody who wanted to pay for a Cadillac before had the option of doing that. And so all you're really doing, you're not giving more options, you're actually taking away options. in this scenario, if they did something as foolish as saying every car has to be at least as good as a Cadillac. So all it would do is raise prices and make a lot of people unable to get any car at all. They'd have to take the bus, ride their bike, walk, and so forth. Okay, so it's not clear that you're helping people, and in particular, the ones who are clearly hurt are the poorer people who can't come close to affording a Cadillac. So it's not obvious why that should be something applauded by progressive leftists, and yet that's the kind of person that would applaud this. It would be like the right-wingers who don't want government interference with business would be the opponents, but clearly the kind of rich capitalist person is not the one who would even be hurt by this necessarily. Okay, so that's a standard way that free market economists explain some of the dangers of government intervention, even if it worked the way it was supposed to. And so I'll explain in a couple slides here why that's actually very optimistic, that in practice, government licensing and so forth is much worse than this. Okay, what else went wrong? So as far as I'm going to try now to give you a quick history about how did we get to that position where health insurance was typically provided through the employer, whereas other ones weren't. So the basic explanation here is back during World War II, there were wage and price controls in force. So as part of the way the government pays for wars since World War I with the Federal Reserve, the Uncle Sam, the Treasury, runs deficits, right? They don't tax as much as the cost of the war in those upfront time period. And so they issue bonds, and then in order to keep interest rates from going through the roof, the Federal Reserve would create money out of thin air in order to then buy the bonds, right? So it was a very complicated shell game by which the Federal Reserve was monetizing the deficits to pay for the war effort. So left to its own devices, that would have made prices go through the roof right away. And so to help contain that, so the public wouldn't fully appreciate just how expensive the war effort was, they just passed explicit wage and price control. So it was illegal for companies to raise prices too rapidly, and it was illegal for them to raise how much, the money wages they paid to their employees were too rapidly. And so one thing that companies then did to attract qualified employees to bid them away from their competitors is they started offering health insurance. Right? So it's not that this was invented in 1941, but this certainly accelerated that trend to where part of what employers gave you was not just money wages that then you could go buy your own car insurance, your own health insurance, your own fire insurance, but they said, we'll give you these wages plus another benefit of working here is we pay for your health insurance. And so the reason they did that was it was ruled by whatever the relevant board was at the time that didn't count towards the wage and price control statutes. So in other words, you're paying someone $20,000 a year in salary, and if you actually wanted to offer $25,000 to get that real qualified person, but that was illegal. That would be violating the wage and price controls. So instead, you offer them $20,000 in salary, and then also pay for health insurance for them and their family. And then the government said, yeah, you can do that. All right, so that was one of the ways the employers got around this. Then even after the war, partly what's kept it in place is the tax treatment. And so typically the IRS, if you're an employee, you getting your salary as taxable income, you getting in-kind benefits in the form of health insurance premiums that your employer pays is not counted as taxable income to you, the employee, but the employer can still write it off as a deductible business expense. Right? So depending on the tax bracket of the employee, particularly for upper income people, that could be a pretty huge benefit, or so a reason that it makes sense for the employer. In other words, if you were going to spend $10,000 of your salary anyway buying health insurance, if the employer says, let me spend it on your behalf, then you both legally avoid taxing that $10,000, right? So that's another reason that that's been now codified and that that's such a standard thing. Okay, so let me just mention it very briefly. So this is a standard point that people, free market-oriented economists, bring up a lot. I think sometimes, though, they read too much into that. If it were just what I said there, if that were the only thing the government did, then yes, that would subsidize the demand for health insurance, right? It would make health insurance seem artificially cheap, right? Because it would be getting, it'd be tax-free, whereas other stuff would be taxable. But you still, all that would really do is make people spend more on health insurance than they otherwise would have, but you wouldn't see these outrageous prices, okay? So just like if the government says, okay, if you go buy a new car, it's tax deductible, that would make people spend more on cars than they otherwise would have, and that would raise average car prices, but people would still get more for their dollars, right? In other words, people would be driving nicer cars. It's just, it would be artificially subsidized, and there'd be, more cars sold and so forth. But it's not that you would look at the price of any particular car and it would be some crazy thing that everybody would know that that's not right, that's outrageous. So it's this particular element that I'm talking about explains part of what's going on, but it's not the full picture. Okay, and in particular, I have seen a lot of self-described libertarian economists that they said, oh, there's lots in the Obamacare Affordable Care Act that we don't like, but we really like that tax on the so-called Cadillac plans, because that finally, fixes the incentives. And so that's odd. If you're a free market economist and you're applauding a new tax on something as a way to fix the healthcare sector, right? I'm saying that's actually not right. I'm not merely talking about, the ideology of it or the fact that, hey, that's my money, what are they doing? But I'm saying if you think the only thing really screwed up with healthcare is this one issue, I think you're misdiagnosing what's going on. But I am just giving you some of the background. That's partly why, if you've seen this commentary, some free market economists applauded this particular element of the Affordable Care Act because they thought it was just undoing this artificial subsidy elsewhere in the tax code. Okay, so back in '62, a big move was the FDA, in response to the thalidomide tragedy, went from just insisting on safety to now wanting proof of efficacy. And that was a bit ironic because, as I'm sure many of you know, thalidomide was not commercially distributed in the U.S. There were some doctors that had gotten it for their own purposes to give as tests to their clients, but it was not commercially available. So if you want to think of it like this, the FDA did its job. And in fact, the president gave an award to the FDA person who was assigned to this case. And even beyond that, it's not that thalidomide wasn't helping with sleeping, right? It's that it was unsafe. And so it's odd that because there was this drug that in other countries caused so many side effects, that the FDA changed its mandate and went from merely insisting on safety to now insisting on efficacy. But that is what happened. And Milton Friedman in 1979 chimed in on this and said, as of that moment, you could clearly see the cost of bringing a new drug to market had gone up 100-fold, whereas prices in general had only doubled in that period, right? So like a 50 times relative increase in the cost of drug production. Nowadays, it's more than $1 billion, billion with a B, to bring a new drug to market, to get through all of the clinical trials and so forth that the FDA makes you jump through. Now, on this, again, let me sort of chide my free market economist colleagues. The standard story that a free market economist gives here, and this is what Milton Friedman does in his popular works, is they will blame the FDA for being too conservative. And they'll say, it's like the Cadillac analogy. They'll say that, the FDA raised quality standards. It makes it very difficult for a manufacturer or pharmaceutical company to show that this drug makes sense to bring to market. And so that delays, so there are people who are dying or suffering because there's this new drug that they can't get their hands on until it passes all these tests. And it makes the FDA, or it makes pharmaceuticals just focus on drugs that have big market potential. You're not going to develop some real niche product if you have to spend basically $1 billion to bring it to market if there's only a handful of people that it might help. So that's all true, but again, they make it sound like that this guarantees that the drugs that end up on the market are safer than optimal, right? And I'm saying there's an element of that, but there's also the flip side, that because the FDA is guaranteeing the safety, the public isn't as dubious as they should be. And there are plenty of cases where the FDA has left drugs on the market that private sector watchdogs, I'll come back to this in a little bit, have said that this should be yanked. This is far too dangerous, for the potential benefits that it can deliver, and the FDA shouldn't have approved this. And because the FDA is a bureaucracy, it drags its feet. So I don't have time to get into the details now. If you aren't aware of it, I would encourage you, just go look up what happened with Vioxx in particular, and you can see that, there arguably tens of thousands of people died as a result of the FDA, approving this thing and letting it sit up there when, it shouldn't have. And again, lots of private sector people were raising red flags about that. Okay, just more on the humorous side, just to explain partly what's going on here. the absurdities of the FDA. So here I'm sort of giving like just, theoretical, even in a perfect world, but in practice you can see how silly the FDA is in certain instances. So for example, if you go and look at, Kessler's one of the early FDA commissioners, and the FDA referred to him jokingly as Eliot Nessler, in reference to Eliot Ness, the Prohibition era agent who was, taking axes and smashing and draining things, because one of his big deals when he first came in, had a big press conference, they had found that there was an orange juice manufacturer that they called it Citrus Fresh. It was like the name of that particular type, and it was from concentrate. And so in order to make sure that this didn't hurt people, they dumped 12,000 gallons of orange juice, right? The FDA came swooping in and dumped it in order to protect consumers from the scourge of orange juice that was actually from concentrate, right? So next time somebody says to you, what harm has the FDA done? You can say, there's 12,000 gallons of orange juice that could have been consumed, right? And so here, and also too, they said from concentrate on the packaging, it's just the FDA said that was too small, all right? So there's that element. Again, another issue here is you may have heard that the FDA has pretty silly regulations when it comes to advertising. So two particular examples. One more serious is with aspirin. For once it became known that it was effective for preventing first heart attacks, there was a situation where, like Bayer, for example, on the packaging would say, "Ask your doctor for alternative uses of Bayer," but the packaging couldn't say what they were. And so you had to go in and ask, because again, it hadn't passed scrutiny for that particular application. And so some experts in this area write about the catch-22 that the aspirin manufacturers were in there, that they couldn't openly advertise this new use for aspirin because it hadn't been clinically proven, but yet they couldn't also ethically go through those hoops, because to do that, you'd have to have a double-blind study, have one group being given a placebo, one being given it, and ethically, there had been one study that had been doing that, and they discontinued it because early on, they realized how effective the aspirin was, so they didn't want to keep the other placebo group not getting it, and so that was the point. In other words, they would have been, acting unethically in order to prove that this thing was effective and safe, in order to then be able to tell that to consumers, right? So that's just one example. A sillier one is, the regulations that the FDA put in place said you were allowed to, if you were going to talk about what the product was going to do, you had to have all the disclaimers, in terms of here's the uses, here are the contraindications. So some advertiser, some things. Well, look, we're just doing a real short ad here. We don't have room, and so they said, okay, if you don't talk at all about what the product is for, but you just want to have a commercial for the name brand, you can do that. You don't have to go through the laundry list of all the things that are possibly wrong with it. And so there was one case where they were filming a Rogaine commercial, and so again, it just showed some hunky guy and ask your doctor about Rogaine, see if it can help you. And he didn't say what it did, and he touched his head, he scratched his hair, and the FDA said, no, you can't do that because that's letting people know it's about hair. And so we got to reshoot the ad without him. He's still smiling or whatever, but you can't touch your head. So again, just goofy things like that. So my point is, government absurdity is also true here. It's not that oh yeah, I know the government's crazy when it comes to everything, but when it comes to healthcare, that's when they're serious and competent. That's not the case. Another quick example, since I'm talking about advertising, this is something where I think a normal person might say, okay, Murphy, yeah, I get in general government bureaucracies are incompetent, they do silly things. But and I don't like government over-regulation of business, but when it comes to something like just giving consumers more information, if there's minimum standards on terms of disclosure for packaging and stuff when people are buying pharmaceutical, how could that possibly hurt, right? You're just giving people more information. Well, I'll give you a specific example, something that I think actually happened. I'm old enough to remember, some of you in this room are too, when they started having these TV commercials for new drugs, and they have the speed reader come in at the end and just list all the things that could possibly go wrong, right? Use of paradoxin might cause nausea, diarrhea, fatigue. Contact your doctor immediately if you start growing a third arm, that kind of stuff. And at first, when those, I was a kid when that stuff, I started noticing that. And at first, when those first few ads came out, and they always show, an elderly couple dancing. For some people, this drug will make you take your wife out dancing. That's always the target market. And when they had the speed reader come in and read that laundry list of possible side effects, at first I thought, why in the world would somebody pay to have announce to the world that this thing might cause you to have diarrhea? That seems weird, and it seems like a loss leader, right? And so those people were really burning the ships. But I think what ended up happening, and this is true, just like normal people now, they see those commercials, and that's so commonplace that, you see the elderly couple, riding their bikes and whatever and smiling, and now they're out and active again because they took this new wonder drug. And then the speed reader comes in at the end, and so everyone just tunes that out now because they say, I think, mentally, to the extent they even notice it, they're like, oh yeah, well, they have to say all that stuff because anything could kill you. And then I think they come back to, if the thing really were dangerous, the government wouldn't let them advertise it, right? And so you see that by the government insisting on, all this laundry list of every possible thing that could happen without giving you any context, without saying, 1 in 10,000 lab rats had this result versus, yeah, there's a good chance, this could kill you. So to only take it if it's, talk to your doctor and really be sure before you try this thing, without giving any context of those claims about the possible side effects. It all just gets jumbled and it's wiped out as white noise. And so actually it's the exact opposite, that now people have no idea of what the relative safety or danger of these products because they've just been overloaded with the government mandated, oh, you got to disclose everything to the consumer. So that's, again, an area where even though it seems like what could possibly be a downside of a basic regulation like that, I think actually in practice now people don't know as much about the potential downsides. Okay, just to show you that I'm not partisan here, a big thing, obviously, when it comes to how did the healthcare sector get so out of whack and why are expenses rising and why does health insurance have to cost so much? A big thing was Reagan signing EMTALA into effect. And here, again, just showing the ratcheting effect. So part of the narrative here that I know I'm going through pretty quickly for you guys is that it's not that the government went from total laissez-faire to single payer in 1 week. It's just a ratcheting effect. For those of you familiar with the work of Bob Higgs, he has this idea of the ratchet effect, what he calls the Leviathan state, where there's a crisis, the government really ramps up the amount of intervention, the crisis subsides, and then stuff drops down, but it doesn't go back down to the pre-crisis level. So it's a ratchet effect that just over time, the total amount of intervention has this secular rise. And so you see that quite clearly in healthcare. They do some intervention to solve one thing, it doesn't really solve that, and it causes some other problem, and then 5 years later, everyone's blaming that other problem on the market, and so the government comes in once again to be the savior, and they just keep doing that. So here, part of how EMTALA, got its foot in the door and how it worked is since the government was already so heavily involved in reimbursing hospitals, it was easy enough for them just to say, well, if you don't do this, we cut off your funding, right? So it didn't matter whether it was constitutional or not, since they're already paying all these medical providers such a huge chunk of their revenue, they could say whatever they want. Incidentally, that's also how they did the seatbelt legislation. I don't know if you guys the speed limits. That, for a while there, the federal government could tell the states you got to have a 55 mile per hour speed limit, and if a state didn't want to go along with that, it's not that the federal government, made them do it and had a constitutional challenge. Instead, they said, okay, well, we won't give you highway funds, right? And so, again, that's part of how the federal government in the 20th century expanded so rapidly vis-a-vis the states is they were already taxing so much from the state's citizens and then giving the money back with strings attached. That's one of the ways they did it. Okay, so in case you're not aware, some of the anecdotes here, we cover them in our book, The Primal Prescription, are really absurd about the kinds of things that happened. Things like somebody, in an area where there was a hospital that was in a high crime area, somebody had been shot by like a drug gang, like 200 yards away from the front door of the hospital, and that was and the hospital gets fined because they didn't send someone out to retrieve the person when there was still active, there's still an active shooter situation. Okay, so there's just really crazy bureaucratic things that make no sense, and so you feel for the individual hospitals involved and what are they supposed to do. And also with this, in case you're not aware, it was the EMTALA requirements is why Mitt Romney, when he was governor and had Romney Care come through, he wrote a letter an op-ed, I think it was for the Wall Street Journal, and he was trying to explain why his mandated health insurance and individual mandate at the state level was a conservative policy. And the way he was framing it was to say, because right now there's plenty of people, because of EMTALA, who are getting health care for free and making the taxpayers pick up the tab. And so this is just a measure of personal accountability. So you can see, given that you're in this box that the government has imposed on you, why it seemed like, little stopgap measures that actually erode freedom could be construed as a movement, towards conservative free market principles. And that's certainly the way he was selling it. So again, all this stuff, obviously I'm not a fan of Barack Obama and the Affordable Care Act, but this is clearly a bipartisan problem. Okay, and the last historical slide here, since I mentioned it, let me talk real quickly about the Affordable Care Act. Something that I think a lot of critics of this didn't fully understand is that you couldn't just get the goodies. You couldn't just get the good parts of the Affordable Care Act. The bad stuff, you had the carrots and the sticks had to come with it. So real briefly here, let me just explain what I mean. So what everybody wanted, of course, was universal coverage. Everybody just wanted the government to say, anybody who wants to get health insurance should be able to get it, period. It's not fair that some people, especially if it's a condition they're born with. Like, that's just not fair that they can't get it. And so, let's just pass a law. So if that's all they had done, if they had just said it's illegal for a health insurer to deny anybody coverage, the health insurers could have easily complied with that. They could have said, okay, sure, yeah, someone's applying, he has a brain tumor, we'll give you health insurance, and we're going to cap the reimbursements at $20,000 annually, and we're going to charge you a $20,000 annual premium. There you go, there's your policy. We're compliant with the law. So you see, that would be a farce, right? And so that's why the ACA couldn't merely have universal coverage. It also had to have the community pricing guidelines, and to say, when you charge a premium to somebody, you can't tailor it to their individual medical history. You have to just classify them on the basis of a few pretty broad demographic characteristics. And they also had to insist on essential health benefits, right? So you couldn't, because then the insurance companies might have said, okay, yeah, we'll charge everybody the same price based on a few characteristics, like the elderly, we can charge a little bit more, and so forth, in compliance with the law, and we just won't cover cancer treatment at all. And so in other words, they could have just covered more middle of the road stuff and just excluded those high cost clients who were clearly going to cost them money, who were going to be, charge them more in reimbursements than they were going to take in premiums. Why would they lose money on them? So they could just do it that way and just exclude reimbursement for high cost procedures. Again, that would have defeated the whole purpose of it, and so that's why the Affordable Care Act had the essential health benefits component in there, to make sure that people get good health insurance policies, the ones that are mandated by law. Okay, if they had just done those things, then what would have happened is the premium would have been a lot more expensive than what healthy young people would have gotten out of it, so they wouldn't have signed up for it, and only people who are already sick or who are older would have signed up for it. And then the actuarial basis there wouldn't have worked, right? There would have been a death spiral. They would have had to keep raising premiums, and it would have become unaffordable again. And so that's why they had the individual mandate, right? They had to have that in there, otherwise it wouldn't work if they had the other stuff in place. Okay, well, now if they have the individual mandate, there's millions of people who wouldn't be able to afford it. And so that's why they had to have the subsidies. Okay, so you see, there was a certain inner logic of it, that once you go down the path of saying we need to have universal coverage, they couldn't have stopped there. It would have just screwed everything up. And so that's why they kept going further and further. So it's a great illustration of what Ludwig von Mises, his critique of interventionism, where he said it's not a stable process, that if you just try to tinker with the market a little bit, it's going to invite unintended consequences, and you're going to have to just keep tinkering with it. And that's why Mises said, society has to choose. Do we want a market economy or do we want socialism? There's no logical third way. Okay, so he wasn't saying by next Thursday either every country is going to be pure laissez-faire or pure socialism. Obviously, that's not what he was saying. But his point was interventionism is not a coherent strategy. People think that they're being reasonable and moderate by saying, oh, I'm not for pure laissez-faire capitalism. It's too extreme and too cutthroat, but I also recognize the problems with central planning. We don't want socialism, so let's have a healthy, and Mises was saying that you're not being pragmatic, that system doesn't work. Okay, another predictable, and I'm not using that term rhetorically, I'm saying I saw economists, my colleagues predicting this before the ACA passed, and then it started happening and everybody was freaking out. They were saying, look at the ACA is forcing certain insurance companies, some of their clients now coming in that they have to take on as clients by law, they're going to be losing many thousands of dollars on. And so what do you think is going to happen? So one thing is that the customer service is going to be poor, right? That you call in now and there's not going to be as many people answering the phone and trying to get your business if you're costing them money. They would prefer you not be their client. And another obvious thing was in certain jurisdictions, so a health plan could just do research and say, in our area, who are the best cancer doctors? And let's make darn sure they're out of network for our plan, right? So they do, we cover cancer treatments and look at the doctors who are in network. They're reputable doctors. They're just not ones that people would have picked as the best. So when people are researching who have cancer, and then we have to give them a policy now because of the ACA, let's make sure they don't pick us. They go to somebody else, right? And so that sort of thing was happening. People were complaining, like, I thought I could keep my doctor if I wanted my doctor, and it turns out that wasn't true. And and of course, were people mad at the Affordable Care Act? Were they mad at Obama for lying? And by the way, I have to give it to him, PolitiFact rated that if you like your doctor, you can keep your doctor. That got the lie of the year from PolitiFact, so I was impressed that they did that. And apparently what happened is, Obama's saying that to audiences, and at some point his staff, even among themselves, were wondering, should we kind of, pull him back because we know this isn't true? Like, is he kind of digging himself into a hole here? It's going to be hard to explain after the fact the more he keeps saying that. And so that was, an interesting dilemma they faced. And so anyway, but that wasn't the outrage. The outrage when these particular health insurance companies were doing it. And you can, again, the average person, they're taking their kid to soccer. They got a lot going on. You can imagine that they passed this thing to try to make the Affordable Care Act, and now all of a sudden I had insurance beforehand, and I had this doctor I liked, and now that he's out of network, that's crazy, And so you can see how they would blame the insurance company, even though, again, this was the predictable response. Of course that's going to happen. Okay, another quick one here. I'm running out of time. I want to leave time for your guys' questions at the end. Another quick one is, and this was funny, again, it's going to be hard for me to convey the whole back and forth on this, but remember, when the Affordable Care Act came in, this was right in the midst of the Great Recession, trying to get people back to work. And so Casey Mulligan is an economist at Chicago, and he did some work. And what he was looking at was to say, okay, part of what the ACA does is it ties the subsidies to afford, Obamacare, to afford your health insurance. It's means tested. Okay, so in other words, the more income you make, if you were eligible to get the subsidy, that gets phased out. And so if you think through the logic of that, it's, in other words, the government's giving you money, but the more you start making, the less money they give you. And so that's like an implicit tax on you, earning more money, right? Because the more you earn $1,000 extra in your paycheck, you don't get to keep that. For one thing, it's taxed. But then beyond that, your subsidy for health insurance, if it goes down $200, well, then that's also $200 less after tax, after you pay for health insurance you have in your pocket from earning that extra $1,000. So it's effectively the same thing as if there's an extra tax rate on work for people who are getting these subsidies, which is the last thing in the world you want to do. You don't want to put another barrier in place to somebody who's poor enough to be getting subsidized for health insurance to then say, if you try to earn more and climb out of this hole, we're going to effectively penalize you more. All right. And so Casey Mulligan, this University of Chicago economist, came up with estimates of how many millions fewer full-time job equivalents would be, offered on the market because of the incentive effects of the Affordable Care Act. And his work was so compelling. I mean, he wasn't just making it up. He was looking at elasticities of supply, blah, 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 your real boring economist stuff. But he was looking at it just like any other, normal thing that an economist would study, and said, hey, this is an understudied, appreciated aspect of the Affordable Care Act. And the CBO and, the JCT, these other, watchdog score-keeping agencies took his research and they incorporated it into one of their subsequent reports. And so you would think, all the progressive champions of the Affordable Care Act who had been, complaining about the Great Recession, we need to have more, stimulus spending in order to create jobs, look at how high unemployment is and that sort of thing, you'd think they might say, oh, geez, well, we still like the policy, even though it's going to have this unintended effect of now, causing millions of fewer people to offer their services in the labor market. And instead, they tried to spin it and said, oh, this is great. Now people can, become artists. And they can, pursue their dreams. Somebody who always wanted to write that first novel, now he can do it because the Affordable Care. So, again, and it was, Casey Mulligan has some funny quotes we have in the book where he's, just shocked and saying, this is crazy. They for years have been complaining about how bad the labor market is and how we need to get people back to work. And I point this problem with the ACA, and now all of a sudden they're talking about people following their dreams and becoming poets, right? So again, just showing that these were predictable results of the ACA. The last thing, this is something that I dug up in terms of this was all in the CBO's budget reporting, but those of you who follow the debate on the ACA, you may have heard one of the big talking points was it pays for itself, okay? And so they were saying, yep, there's going to be like $1 trillion in new spending, but don't worry, there's a bunch of tax revenue increases that also is $1 trillion or even a little bit more. And so they were saying, don't listen to these Republican scaremongers talking about, it's going to blow a hole in the deficit. No, it won't. And the conventional wisdom was that the rich were going to pay for everything, okay? And even if that were true, even if it were just a tax explicitly leveled on upper income people, that would have, knockoff effects and hurt regular people too. But even on its own terms, I was just digging through the numbers. So again, these are ballpark, but over the first 10 years, the CBO was saying roughly the Affordable Care Act means the federal government will spend $1 trillion more in extra spending for subsidies and, payments through Medicare and what have you. But it will also raise roughly $1 trillion in extra revenue compared to the baseline before the ACA. And so it pays for itself. It'll be deficit neutral. Of that $1 trillion in extra revenue, $240 billion of it came from this mechanism. And like I said, I didn't see any, this is in the report, but I was, we put it in our book and I was blogging about it. I didn't see anyone else pick it up. The way the CBO was coming up with $240 billion was they said, okay, the Affordable Care Act is going to make it so employers aren't going to want their employees to get employer-provided health insurance anymore. And so they're going to say, instead of us giving it to you, because now, it's more expensive, we're just going to give you a higher salary. And we'll take the hit and, pay fines to the government because if they're a big employer. And then, you go buy your own health insurance. And so the CBO modeling thought a lot of employers were going to do it. It turns out they were wrong, but this is the model. This is how they came up with the deficit neutral figure. They thought lots of employers were going to tell their employees, instead of us providing health insurance, we're just going to pay you more money. You go buy it. Like they could get it from the exchanges or whatever. And then the IRS was now going to say, okay, well, your salary just went up. Before you made whatever, $50,000 plus you got $20,000 of employer-provided health insurance. Now you're just getting $70,000 in base pay, so we're taxing you on $70,000. So regular workers were going to be paying more to the IRS, not because their tax rate went up, right? So it wasn't a tax hike on the middle class. It was just their regular base pay was going to go up if their employer kicked them off the employer plan and wanted to retain them as employees. Says, we'll pay you more. What we were giving you before in a premium, we'll just give to you in your paycheck. And so that counted for $240 billion of the revenue that the CBO was saying the Affordable Care Act would bring in. And yet, I don't remember Paul Krugman ever mentioning that, surprisingly. Okay, so as I wrap up here, because again, I want to leave time for your questions. You guys know this, I'll just say it just for official sake, but the market, this isn't mere theory. We can see it happening, something like LASIK surgery or, concierge practice, just direct cash payments, anywhere where people just have a regular business transaction where the patient is the client who's paying for it. You see the operation of the market. Prices come down, quality goes up in these areas. It looks like the computer sector when it comes to something that's out of, some elective cosmetic surgery. It looks like the way, when you buy computers, it keeps getting cheaper to get a given thing, the quality keeps going. That's what happens here. It's only in the area where it's not run like a business that you see these absurdities. All right, so we can see these realistic outcomes before our very eyes. Some even more radical prescriptions in terms of, okay, you've diagnosed the problem, what can we do? You could certainly abolish the FDA, and if that seems too radical, but again, I realized that when I heard Keith up here that this is not too radical for you guys, but at the very least, you could say, all right, just don't make it mandatory, just make it voluntary, right? So the FDA can still get up there and give its blessing or stern warnings about products, but then leave it up to the individual consumer, right? So even if you slapped a label on the packaging saying, the FDA has not approved this, okay, that certainly would be a better, much better system than what we have right now. Also, again, just to give a specific example in terms of showing this isn't science fiction, this subscription magazine called Best Pills, Worst Pills, at least as of when we published our book, The Primal Prescription, which came out a few years ago, as of that point, since their inception, this magazine, it had successfully predicted every single case of where the FDA originally approved something and then yanked it from the market, right? So like reversed its original approval. So this magazine predicted that in every single case, like knew ahead of time. In some cases, it was like 3.5 years ahead of time. So in other words, this magazine said, you know what? The FDA just approved this thing. We don't think they should have. They're going to retract it at some point, right? And so again, it caught every single example that, because again, there's nothing magical about working for the FDA. It's not that they have some secret knowledge about how medicine works that no one in the private sector can have. And beyond that, it's just there's competition, right? If this subscription magazine kept getting it wrong, they would lose their subscribers. People would go with somebody else. Whereas with the FDA, this is the perversity of it. If there's a plane crash, because the FAA, so not the FDA, but the Federal Aviation Administration, just switching analogies here, if there's a plane crash, then that happened on the FAA's watch, so you would think that should be a strike against government regulation. No, everybody says, oh, the FAA is understaffed, they need more money. So it's weird, whenever the government screws up in its self-proclaimed role of guaranteeing safety, the regulators get a bigger budget and get to hire more people, okay? And so I'm not saying they're intentionally letting planes crash, but my point is, why would you think that system would work very well? At least if it comes to private certification, then there's competition involved. And so likewise, too, again, getting more radical, get rid of medical licensing. So again, people think, oh, so consumers are going to be at the mercy of quacks. And the point is, well, no, there still would be certification, but it would be private. Or so somebody running a hospital, they're not going to hire a brain surgeon who just comes in and has a winning smile, right? They're going to say, what are your qualifications? Where'd you go to school? And the same thing, medical schools, even without state accreditation, obviously will have to have certain standards and a reputation. Otherwise, that degree won't mean anything. Okay, so again, I know normal people would be horrified by this stuff, but this is standard things. There's nothing magical about the state signing off on somebody. Okay, and the last thing that I think is a good one, just to kind of shock people, is to say, like, why isn't there a market for kidneys? And this, again, the average person, oh my God, they're horrified, but you talk them through it, and because again, this is something where the abstract intervention with the market, I don't like that. Well, this is where arguably, I've seen different estimates that saying, if we allowed for a market in kidneys, they estimate that probably if they paid $10,000, for cadaver donations, and I think it's like $15,000 for live donors, that would probably satisfy. There might be an initial period where they catch up with the unmet demand, but once that system got up and running, going forward, there would be no more waiting list. Okay, and what's interesting is that it might even save money for the system as a whole. In other words, dialysis is so inefficient and costs so much that it would actually, even including the cost of paying someone for that donation, it would be cheaper to go ahead and do that. And obviously, that's a much better solution than just having someone perpetually be on dialysis, right? And so and arguably, I've seen estimates saying if they move to that kind of a framework, you could avoid 5,000 to 10,000 premature deaths every year. Okay, so again, this isn't just some abstract whining about economic liberty. This is thousands of people per year that could have a much better life if they implemented this thing. And really what's holding it back is just, that's icky. A market for kidneys, that grosses me out. And that's really not a great objection when there's so many lives at stake. Incidentally, in terms of, let's have something politically feasible, Alex Tabarrok, who's an economist at George Mason University, he's done a lot of work on this to show sort of intermediate things, like to say, okay, let's allow for the payment of donations, but still allocate the kidneys based on the current method, right? So it's not just going to the highest bidder. If we had a market for kidneys, only rich people would have kidneys, that kind of objection. But it's, saying the real issue is here. We have thousands of people dying every year, taking both kidneys into the ground with them, when they clearly would have been willing to donate them if it meant their estate would now get an extra $20,000, and yet that's not happening. And it's not a matter of just letting Warren Buffett buy kidneys, but you could use the current system. So again, I like to present the free market radical approach first, but there's all kinds of halfway steps you could take to get closer to this kind of a system, and it's just crazy right now how backward the system is. Okay, so thanks everybody for your attention, and are we turning back to you? Okay, so thanks, and I guess we got time for a few questions.
And slide number 5 was dealing with the ACA. You're a smart economist. The 30-hour per week requirement for full benefits above that level, what has that done to dampen the labor market or create inelasticity?
Okay, sure. So, and thank you, an astute observer saying I'm a smart economist. So yeah, the ACA, I think, I don't know if they changed it, but I think originally it was a 35-hour. So they were saying the mandate on employers was saying it was for people who had more than 50 employees, and if they, it had saying if you had full-time employees, you had to provide them with, this type of health insurance, and it was a very generous package. And there were huge penalties if you didn't, and I think the cutoff was 35 hours, at least originally as the legislation was written. And so there was a lot of anecdotal evidence for sure. There were a lot of like adjunct professors, I just know this just because I have, colleagues in academia, where the college literally would, sent out an email the summer before going into the fall saying we are capping, you're only allowed if you're an adjunct to teach this many classes, because they didn't want you to go over that minimum and then qualify and be a full-time employee. So again, or also, firms that had 47 employees and they were thinking about expanding, well now if they just hired 4 more people, that was a huge increase in their marginal cost. So they would, would have refrained from doing that. In all honesty, I did try showing that statistically, and there was no smoking gun, at least as of when I last checked, in terms of, because there was the Great Recession hit, and then there was the recovery coming, so the labor market was going through some wild swings. So it was somebody who liked the ACA could say, oh, that's all noise, all right? So in fairness, it was hard to look at the numbers because there was so much volatility in the labor market going on at the same time. But certainly there's plenty of anecdotal evidence that certain employers, obviously, you're saying I hired just a few more employees or I give them a few more hours, and all of a sudden they're thousands of dollars a year more expensive. Why would I do that?
Yes, one prescription that I did not see up there that I think should be considered is eliminating the tax exemption for employer-based insurance. Have you looked into that?
Okay, yeah, so the question is about the tax exemption for employer-based insurance. So yeah, that was one of the things I covered, and you're right. So that, again, just to make sure everyone's getting the logic, it's true that if the employer pays for your health insurance, the employee doesn't have to pay taxes on that, and so that is an artificial incentive that makes employees effectively sign off on spending more than they otherwise would. I think, though, that's not the main issue. So if the question were just get rid of that or not, I wouldn't want it, because that's a tax hike. If that were part of a broad-based general thing about lowering tax rates across the board, okay, I could be for that. But that one particular thing, if you're saying if we just tax this more, would that fix things? I wouldn't say that.
You benefit from that, but I don't benefit from that because you have tax-exempt health insurance. So it is unjust to a large number of people in this country to have that tax exemption. For small businesses, for the self-employed, for people who have Christian medical cost-sharing plans. And I estimate, as a primary care physician, that it adds about $1 trillion a year to the economy. And it takes away about a million persons who are doing, all they're doing is settling small medical claims when we have a 3.8% unemployment rate. I think it should be a part of the Republican policy going forward to eliminate that tax exemption.
Okay, yeah. So
it
again,
would hurt you, but it wouldn't hurt me.
I get the logic of what you're saying.
Yeah.
All I'm saying is,
I think you're blind to it because you have a tax exemption for health insurance.
Okay, I mean, and again, I would just say, well, I'm also against hiking taxes on people.
Hi. Somebody has to pay that tax. My turn.
I got to be like the crude operator, not smooth operator. Make sure that you ask questions. So far, we've had great questions, but make sure they're questions and not filibustering like Congress or the Senate.
My name is Kush Gupta. I'm a medical student here from Stanford. Thank you for speaking today. My question is related to your comment on EMTALA. So my understanding of EMTALA was that it was enacted because many doctors, such as radiologists, NICU docs, and especially EM doctors, were forming their own unions and contracting with hospitals. And so while hospitals were accepting certain insurance carriers, these doctors' unions were billing separately and saying, we won't accept payment from insurance, and therefore you as a patient have to pay us separately. And so your point was valid in that EMTALA did increase costs for hospitals by saying, go out and take care of that gunshot victim, but at the same time, it also did mandate that doctors take care of patients, where otherwise EM docs were just turning them away. So how would you maybe equate those two disparities? Thanks.
Okay, great question. So I'm not familiar with the first part of your thing about the unions and the radiologists and whatever. But yeah, so again, with all this stuff, any given episode, just like I totally understand why people supported the Affordable Care Act, right? Healthcare was screwed up, however you want to define that, certainly going, in 2007. And so, yes, I understand why health insurance gets so expensive and people go to the emergency room, you get these huge bills, people can't afford it, so the hospital's turning people away who aren't insured. We as a country, someone who's homeless or has an issue and shows up having a heart attack, we're just going to kick the guy out, he's going to die in the street. I mean, nobody wants to live in a society that does that. And the issue, though, I'm just saying is, notice every time we came up against something like that, the solution was always, let's get more government involvement, as opposed to, well, gee, the reason it used to be that physicians did a lot of pro bono care, right? And that was one of the ways that the community, we as a society aren't going to just turn a blind eye to the indigent who need health care, because that was but now, when it's effectively many thousands of dollars for a particular treatment, that's asking more to just say, oh, just do it all for free. So again, I'm not trying to minimize that is an issue, but I think, again, that certainly EMTALA didn't fix it, right? It's not that all of a sudden now everyone gets affordable health care. It's that it just shifted the burden to somebody else. So I think, again, the issue is why is it so expensive?
One last question, because now we're standing between you and your break. Yes, sir.
Okay, I'll talk really fast. 1999, my house got removed from the face of the earth by the world's biggest tornado in Oklahoma City. And 2 days later, the governor of Oklahoma got on the radio and said, all you guys who are charging 75 cents a bottle for water and now are charging $4, we're going to fry your bacon for price gouging. A few days later, I have a client that needs to have triple bypass surgery. I'm on the side where I try to help find my client's pricing, okay? So we shopped several hospitals in Oklahoma City, found the rates from $50,000 to $150,000 for an emergency situation with triple bypass. At least I would think that's an emergency. Why is that not price gouging?
Okay, yeah, that's a real interesting. So in case you missed it, the government's against price gouging, when there's a natural disaster. I think you're right that the logic there would be the same. And I think the reason that doesn't strike the average person is because when it comes to, there's a flood or a hurricane or something, and all of a sudden batteries and generators and bottled water all of a sudden are 50 times more expensive from 1 week to the next. Everybody knows, oh, I know how much a bottle of water should cost. Whereas the average person, they don't really know, oh, no, really, this operation really only should cost such and such, and it's, they don't have that experience. So I think you're right. I mean, the logic there would be the same, but the public doesn't see that. So I guess it's good because the crackdown on price gouging by itself, I don't think is a good idea. But I get what you're saying, and that should be construed as the same. And it's not, again, just because I think people don't know what a free market price would actually look like.
All right, would you join me in thanking Dr. Murphy?